To me, the Child Life Council is a great resource for anyone who is in the child life field or wants to someday pursue it. I have used the Child Life Council to find the practicums and internships that are offered throughout the entire country. It is a great resource for students who are interested in pursuing a degree in child life because it gives a directory in child life programs and requirements for certification. Personally, I think that this resource is very beneficial. After this semester, I became more aware of the different things that the Child Life Council offers, such as networking, career resources, annual conferences, newsletters, and other factors for child life specialists to gain more information and be up to date with child life. It is a great way to connect with other certified child life specialists from your area and the country. I am now more aware and my perspective is now more in detail of what the council is all about and the many ways I can utilize it as a future child life specialist. When it comes to the scope of the child life practice, I was aware that child life is a profession that involves a child life specialist and a child who needs a support system. Whether it is a child who has been diagnosed with a terminal illness, going through surgery, or a loss of a family member, Child Life is a resource that allows children to cope with their emotions and challenging experience through therapeutic play. Not only do they provide emotional support for children, but for their parents and caregivers and siblings as well. They encourage development of children while facing difficult experiences. They are able to give resources and guidance that educate parents. After this semester, I became more informed of the different areas that child life is needed. For example, proton therapy was definitely a new area in which I was introduced to this semester. Other areas included hospice care as well. My perspective in child life has become more detailed and my passion for it has only increased as I became more aware of the different areas that child life is utilized. Before coming into this class, I knew that one of the major areas that child life was involved in was in hospitals, where children and families are faced with injury, illness, and healthcare daily. When you think about us as adults, we never like going to the doctor or getting sick. We are always anxious and worried of hearing bad news from the doctor. Now, when I imagine a child, I can just imagine the anxiety and stress elaborately much higher. Not only is illness and injury stressful for the child, but also for the parents and caregivers and their siblings. This is where child life is able to alleviate some of those negative emotions through therapeutic play. In addition to having a sick child, dealing with healthcare and insurances can bring a lot of stress and weight on parents. Maybe they have to take a lot of days off of their job to be there for their family, or maybe they have to quit their job. What about the siblings? Who is going to watch over them while you're taking care of a sick child? A lot of factors come into play when being hospitalized. After this semester, I was able to expand my knowledge on how different conditions, illnesses, and injuries have an impact on families. For example, the proton therapy affects the child differently than a patient who is just in a hospital in the oncology unit. They are both similar, but the treatment is something that impacts them differently. Also, my perspective changed on what the different resources certified child life specialists are able to give parents to help lessen the stress, such as support centers in their group. Child Life is a service that involves patient and family-centered care. Child Life is all about putting their patients and family first. They are seen as a support system and go out of their way to make sure that the child is developing as properly as possible, coping with their emotions and experiences, and being able to practice self-expression activities. In addition, Child Life focuses on the family by being able to give resources so that they can use to better provide for their child. Child Life is there to also help parents cope with their emotions and challenging events, and most importantly, the siblings as well. Everyone copes differently, and Child Life is able to focus on helping the family learn how to deal with these situations together as a family. After this class, I learned the different types of education that they teach to parents, the different types of coping strategies that they use for different children based on their condition, and also how the siblings are involved as well. I was also able to learn how parent involvement highly affects a patient. Patients want to feel safe and as comfortable as possible, so having their parent there can create that. Most importantly, I learned how you are faced with families that come from different cultures and backgrounds. No matter what race, age, culture, or gender, Child Life is a resource that should be centered around the family. Lastly, I was able to gain more information on the ABCX model that is used to describe how stress affects a family and how that stress can be alleviated. One of the main tools that Child Life uses for their patients is therapeutic play. Play is a universal language for all children, no matter what race or gender. Being in a hospital, children are frightened. Child life specialists use therapeutic play to normalize the environment as much as possible. Play is something that they are familiar with and a way for them to communicate with their emotions and experiences more easily than words. My perspective on therapeutic play definitely is more in depth after this class. I was able to become aware of the different toys and tools that they used for children when Krista Stringer came to speak in our class. Some of the things she brought to the class that she uses with her patients was coloring books, medical dolls, materials in which they can express their emotions, and more. In addition, I was able to learn how therapeutic play differs with each condition and how they can modify their toys to teach all the children. For example, when Kara from the Proton Therapy Center came, I learned how they use the therapeutic doll when teaching children how still they have to stay and the mask that has to be used. Therapeutic play is something that isn't known to many who are not aware of the field of child life. However, it is something that is very, very beneficial for children who are going through challenging events. Before coming into this class, I was not fully aware of preparation for children and education for parents. As mentioned before, Krista Stringer was able to give me more insight on how to prepare a patient for a procedure. Before this class, I knew that the goal for preparation is to reduce the fear and anxiety for a child who is overcoming a medical procedure. This process includes stress and heightened fears for patients of all ages. When Krista Stringer came to speak, my perspective on preparation became more detailed. I learned that it is always important to let the child know what you are going to do and give them set instructions so they are aware and not caught by surprise. I was able to learn how when children are nervous about taking a medicine or getting a procedure done, it is always important to relate it back to other children, because as a child life specialist, we don't know what it's like and have not been in their shoes. So when they ask, so how is this going to feel, or how is this going to taste, it is important to relate it back to other children, such as, well, some children tell me that it tastes like this, or some children tells me it feels like this. I was also able to learn how preparation is different within all ages. For example, a fear for a preschooler patient might be different from another preschool patient. Every child has their own fear and the way they cope with their fear and stress. Preparing a toddler and a teenager is going to be different and will need different approaches to the different condition and ages. It is always important to consider their specific fears and stressors to accommodate every child. Child life is not only faced with children who have been diagnosed with an illness or condition. They also practice therapeutic play with children who have gone through a loss of a family. Personally, I figure that death is something that is challenging for younger children to experience because I feel like they do not fully understand the concept of death. After this semester, I learned how, when talking to children about death, it is important to always use the same clear and concise language. I learned that there are many misconceptions that are common with children. For example, we should not use terms such as the person went away or the person went to sleep. Also, it is important that the child knows it is not their fault. Before taking this class, I was aware that children and caregivers grieve differently. A child might not want to express their emotions and just stay quiet. It is important to let the child know that expressing their emotions is okay and to encourage them to remember positive things. My perspective with grief and death has become more elaborate as I have learned the Kubler-Ross stages of grief and also the different types of resources that is given to a child, parent, and sibling. I learned that it is important to keep an open mind and heart as children will grieve differently. The younger children will not understand death, and it is important as a child life specialist to always be honest and use the proper language. The older children might not want any help or may hide their feelings as their way to grieve, and sometimes that is okay. Some of the resources that I learned from this class is hospice care and grief support centers. This will help children and families cope with their emotions as a family and in their community. Before this class, I never knew much about self-care when being involved with children and families. At one point or another, we all have been in a situation where we put someone or an event before us. As a college student, I know we have all had those nights where we are drowning with homework, projects, papers, and exams all in 1 week. I know personally, once I start a job, I have to complete it. No matter what time it is, how tired I am, I always have the need to finish what I started. Sometimes we focus so much on something and let it take over our lives. We lose sleep, we lose appetite, and sometimes we don't even take care of our hygiene. Sometimes we just need to take a step back and think, is this healthy for me? My perspective on self-care has definitely changed. I used to believe that self-care was just involved with school or work, but really thinking about it, self-care is extremely important when working with children and families. I have learned that you have to set professional boundaries within the families you work with. As a child life specialist, you should never get attached to the families and create a relationship outside of the hospital or the area that you're working with. I learned that when grieving, it is important to grieve for the family and not with the family. I learned that at times things may get stressful and busy. However, it is important to know what your personal limit is and when to say, okay, I need to take a break. As a child life specialist, a child and family is your first priority at work, but that should stay at work and should not be taken back home with you and into your personal life. Taking care of yourself will help you take better care of a child and their family.